Well, we're still talking.
That was my bad.
That's okay. Hi, everybody.
Hello.
Welcome to our childbirth education Oh, sorry, you were behind. Our live tonight. We're excited about this one. Hi, everyone that's joining. Thanks for coming. And we're gonna keep this one. Could go on forever.
It's a not a heavy topic, but there's a lot of information.
So much
with
information.
This one.
And it actually, with each topic, it grows with questions. So we understand that
with each number.
Meaning, I guess what I mean is, like, once we talk about the topic, you're going to be like, well, what about this? And what about this? And we do the same thing. So there's going to be lots of questions, maybe not. But hey,
hello.
But we're going to just go through these. We're going to just go through them, and there's 16.
Okay, so tonight's live is all about your rights as a childbearing woman. So in essentially, any person who walks in the door of a hospital have patient rights. You have rights as a patient. And so these are essentially the patient rights, but then in specific reference to childbearing women. So that is what's really cool about this.
Because you're different than the typical patient in the hospital. It's a different scenario. You're not going there because you're sick or afflicted or dying. You're going there for something very exciting.
Yeah. It's
so you have some particular rights, and a lot of our sources come from the nationalpartnership.org.
And they actually have a brochure of your childbearing rights. So
in their research library,
as a doula, I used to actually order their brochures and then give them to my clients so that they had a brochure, but I couldn't find where you could order those anymore. So I think you can just access them online. We will have a link to it in our email. For our Thursday email, we'll have a link to it, and we'll probably just make a really cute PDF with all of them too.
Because it's a lot of information, and it's a lot to spew at you, but take some notes, get a pen and paper and take some notes. And then again,
sign up for our email because it'll come directly to your inbox. You can have the information there with you all the time, so you can refer back to it at any time. Where this live will expire within 24 hours on Instagram, but it will live on longer in your email if you sign up for our emails. So so let's just get started. Okay, so 16. We have 16 rights as a childbearing woman. So the first one is: every woman has the right to leave her maternity caregiver and select another if she becomes dissatisfied with her care. So
at any point.
At any point. And we're talking even when you are in labor, you can actually ask for a different care provider or the on-call doctor or something like that. So, which is kind of crazy and kind of cool, because I have talked to a lot of women that think that, like, oh, I'm too far into this. Like, I can't turn back now.
Most of us will say something like that. Like, it's too far.
And that's not necessarily true. If your specific goals have changed and you want something different and you're not aligning with your care provider, you can absolutely get a new care provider. You can, or you can stay with the one you want. Or you have the night along with this is, if you are maybe at the beginning of your pregnancy, or those that aren't pregnant yet or will be again someday, you can shop around for a care provider. At the beginning, I highly recommend it that you set up interviews. You research quite a few and decide, okay, I feel like I'm resonating with these ones, and set up the initial interview and consultation. Take some papers with some questions on them, and ask and find the care provider that's going to jive and mesh the best with you.
So we have also helped to provide that for you as well. On our website, deardarby.com, there is a drop down at the top that says 10 questions to ask your care provider. Now, we did it particularly for an unmedicated birth, just because we find that sometimes there's more questions to be asked when you are requesting an unmedicated birth, and maybe that's your ultimate goal, but you don't really mind if it changes. They're good. They're all good questions.
Just good good open discussions,
interview
honestly. Yeah.
questions. Because again, your doctor, they could be the best Harvard educated doctor and have the very best everything. But again, if your personalities don't quite align and your goals don't align, then it doesn't matter if it's the best doctor ever.
You're going to want the person that's going to work the best, because it's a vulnerable situation for you. And so you want to make sure that you are gathering the right team that's going to help you succeed and achieve the goals that you have put in place.
So if you interview your doctor and get the best midwife, doctor, whatever care provider that you can, then you won't need to worry about firing them usually.
Yeah, that's true. And sometimes it just evolves too. Like for me, I did a lot of research and I loved the group. I had a group of midwives with my first baby that I really enjoyed. I thought they were all fantastic, but ultimately I wanted,
sorry, my husband called.
He's out of town.
So,
he's downstairs. Just kidding.
He'd be in big trouble.
So I ultimately changed to 27 weeks. I was 27 weeks with my first baby, and I just decided I wanted a midwife that I would know me, that I'd see every single time, and that I could be best friends with. That was hugely important to me, so I changed.
And they are best friends.
And they are.
So it's super cute.
I am.
She is.
She is my best friend.
She is.
I do.
So number one, you have the right to change your maternity care provider at any time in your pregnancy.
Yes. Okay. Number two, right, you have is you can actually, these are kind of negative at the beginning, but like,
but they're not really negative.
They're just fascinating, fantastic information to have.
Yeah.
Number two is you can fire a nurse when you're in labor. So it kind of feels like when you go into labor, it's luck of the draw, right? You did all this work to find the care provider that you want, and yet you go into labor and they're the ones that are kind of there with you at the birth, right? And you hear often like nurses can make or break your birth. And guess what? You have actual control in that as well. So if you have a situation where your nurse is not really jiving with you, or you're feeling some
negative juju, or whatever.
What's the word when looked down upon some, like
judge?
No, when you're condescending. Oh, I've had there was one situation where I was in a birth where the nurse was very condescending. Every time she talked to the mom, it was like, all right, well, okay, we'll see. And it was like, it was clearly demoralizing. Yeah. And but that's been the only one. Most nurses are fantastic.
We love nurses.
Oh my gosh.
They're the best. But guess what? Everybody gets to have a bad day.
Yes. And that's just it too, is she might have had she might have been a fantastic nurse on any other given day, but that might have been she just had a really rough situation. And just because she's having a rough day does not mean that needs to affect your birth. So what I recommend is that if you have a situation where a nurse is not working well with you, then I highly recommend that the dad or the partner
or your doula.
No, I would say.
Oh, you wouldn't?
No, I'd say more it's better to come from the partner.
You're right. That's
from
true.
the partner. Yes. And just says, go out to the nurse's station and say, hey, can I talk with the charge nurse? And because there's one specific nurse that's like over that all of the nurses for that shift. And so the charge nurse will come and then just very politely say, hey, Nurse Jackie's awesome. And I know she probably knows her stuff, but we're just not, our personalities aren't meshing, or what, like you can say what it is that's the problems that you're having, and just say, we are really trying to go unmedicated, or we need somebody with a lot of humor, or like, it depends on what it is, what
or more hands-on,
what you're looking for,
or less hands-on.
Like somebody that we really want to just leave us alone, or whatever it is that you're looking for, and just say, do you have a nurse that would work better with us? Because that's what we need and want. And she'd probably say, yeah, sounds good. I'll send.
And it won't necessarily dock them or whatever. It's just gonna,
it's just gonna they'll just restructure who's going where, and it works out really great. So
that's a good one. So you can do that. So number 3.
Yeah. Do you want to say it?
You go ahead.
Okay. Number 3 is every woman has the right to freedom of movement during labor, unencumbered by tubes, wires, or other apparatus, and to birth in any position she wants. Did you know that? That was a right that you have. So
it's a good one.
It's a good one, and it's good to know because a lot of times you go straight in and they strap you to some cords, which is good. They need to know like what's happening, but you don't have to stay that way. So you can, it's called intermittent monitoring, where you're being monitored. The monitors, there's a contraction monitor that is actually not really measuring how hard your contraction is. It's actually measuring how hard your uterus is, if that makes sense. Just a little side note. So and the other one is the baby's heartbeat. So the monitors go on for 20 minutes. That's all they need, 20 minutes. And then for the rest of the hour, they can be off. And but here's the deal. You might get a situation where you have to remind them to remove your monitors, because it's actually can be super easy for care providers, nurses, and to just have you hooked up to the monitors, and then they can be doing what they're doing out in the hall and have because
they can see you.
They can see you out there
from their station.
They know what's going on, and so that's why when things kind of happen or change, that's when they come in. So, so you can. So if that's the case where they're like waiting 30 minutes, 40 minutes before they're coming in to take it off, you can be more proactive and say, okay, I'm taking off my monitors now, and just tell them it's been 20 minutes. I'm ready to take it off, and then move around.
Yes, because we love. So Krista just said, I wish I'd been more insistent on moving around in labor. We find as doulas that the more you move, the better things
the faster
progress.
Things progress, the more effective your contractions are. Things just work out a little bit better.
Yes.
Think about it. When you're moving, that helps that baby swirl down and out. So it really actually helps.
And it actually is a very effective pain relief option, is to be able to move your positioning. You'll find that one position feels really good for a while, and then it starts not feeling so good, and then you change your position and that feels good for a while. So not only the movement of helping the baby descend, but also your own comfort. It really can allow for that.
And then it also allows your birth and support team to access different points too. When you move, they can have access to other points that they might not have had before. That does offer even more relief.
Yes. So, and we have a good question from Ashley. This is a really great question. So she asked, wait, you can't move around with monitors? So that's
excellent.
A good question.
So
thank you for asking.
They're typically corded and into the station stand that has that's doing the printout of the things. And so they're not super long, but they're not super short. So you can move around. You don't have to be on your back in the bed. I often suggest that you get the birth ball and you sit on the ball right in front of it. So even those 20 minutes that you're being monitored, you can be in a different position. You can be on your hands and knees if you want. You can be on the ball. You can be standing. You can be up and swaying. You can be, walking around in circles if you want. So
you can, there is movement. It's just restricted movement. So it's not a lot, you can't go in the hallway and just roam around.
Although they do have they do have wireless monitors now. However, if it's uncomfortable for you at all, get it off, because it doesn't need to be that way. This is the interesting thing, a little tidbit that and you can ask your care provider this specifically, but they've come out with the wireless monitors that are actually now doctors have the ability to download apps onto their phone, so they don't have to be actually at the hospital to be monitoring what their patients are doing in labor. So I've had actually a couple of moms that were in labor that the nurses were pretty insistent that they keep the monitors on. And finally, one mom specifically was like, why? And she's like, well, your doctor can see what's going on with you. And so she wants you on the monitors. So if you have to decide if that's okay for you or not. For her, she did not like that. She's like, if she wants to know what's going on with me, she can come to the hospital and talk to me. So she told them to remove the monitors. But for others, I've had it where it didn't bother them. They were fine with it. It's whatever.
Yeah, and the monitors didn't super bother me, but I love what Krista said, because this happened to me too. My monitor kept shifting while I was moving.
Yeah.
So I wanted to move, but then I'd shift, and then the nurse would come over and like make me get on my back so she could readjust me.
So here's another, okay, so I had another, we're never going to get through these because I have so many great. This is where you have some awesome opportunities to allow them to show up for their job a little bit more. So I had one mom that she was laboring, and she was in some really good, hard, active labor, getting close to the end, and she needed to be monitored at this point. But she really liked being on her hands and knees. But when she was leaning over and on her knees and leaning over, the monitors weren't picking up the heartbeat. So guess what? The nurse actually laid underneath her and held the monitor up to her belly while so she didn't even have it like attached to her. She just held it to her for the 20 minutes.
Wow,
that was
awesome.
Amazing. It was so cool. So nurses are awesome.
Yeah,
and they can be awesome. So if they're having problems with it, and say, if you really need it, can you just hold it there? I need to be in this position to function the way that I need to function to be able to labor.
And that's your right to be able to ask. And so, and if she can't, maybe a birth partner can and help out. There's always things that you can do. But remember, your comfort is first and foremost.
You are the one doing the work. And we are all there to support you.
Yes. So, I mean, they might say you have to be monitored, and then you say, okay, I want to move. I need to move. So how can we compromise? What's a good way to compromise? So, and again, hospitals and nurses, they are very accommodating.
Can I tell you this too? Little side note. We are friends with quite a few nurses. Yeah. We love them. They are just wonderful. We've been able to work with them, and we know how awesome they are. And so I had one nurse in particular. She's like, okay, I am a nurse. I am employed by the hospital. I have to follow hospital policy. And I wish more women knew that they didn't have to follow the hospital policy. So the way she said it, she said she had a mom that was laboring so well in the tub. And she's like, but it got to a point where I had to say, okay, you got to get out now. But I knew she was doing so well there. And if she would have just said, no, I'm not leaving the tub, I could say, okay, and then put it in my notes. Mom refuses to get out of the tub, and I'm off the hook. She can do what she wants, and we're good to go. So just know that
they have to ask, and they have to do,
they have to follow, and it sometimes makes it feel like you have to, but not necessarily.
And the thing is then they will tell you the risk and benefit, because that's your fourth right, is that you have the right to receive in advance full information of the risks and benefits of any pain relief methods, like epidurals, any interventions, anything like
we're talking all the risks and benefits.
All risks and benefits. So if they say you have to get out of the tub now, and you say I don't want to, and you can say, well, why are you asking me to get out of the tub? And they can say, well, these are the 10 reasons we want you to get out of the tub. And you can say, okay, well, what are the benefits? And they can say, these are the 10 benefits for you to stay in the tub. And then you can say,
or like, okay, if you want an epidural, now's the time. But you're not like, oh, I'm not sure I want an epidural, I'm doing okay. You can ask what other pain relieving options you have, and they can be like, oh, well, we have a morphine shot, or a
TENS unit,
or
any like
water.
local.
Yeah, you can get in the tub. I don't know. Yeah,
there's several things that you can do, but again, it's just that you're right to ask the questions. One other question I wanted to talk about was, Veronica asked if hospitals are okay with you bringing your own birth ball. And absolutely yes. And
ask them.
Yep. Yeah. And a lot of them have a birth ball there for you. So,
but sometimes I would say most of the hospitals I've attended, they have one birth ball. So,
oh really?
Yeah. So one or like a couple.
Several. Like they had birth balls plus like the peanut ball.
Yeah. Well, that's what I mean. Is like there's one peanut ball, one birth ball. Like it's so.
Or maybe we were the only ones using
one.
They were like bringing them in. like, here.
Oh, that's cool.
Yeah.
There was one like squat bar, one
yes, with the squat bar. Yes.
So things and the birth stool. So if you want to make sure that you have one, or if you have one that is like perfect size that you really like, because you're not guaranteed, I guess, to make sure like, it could be smaller or bigger or something. So yes, you can absolutely bring your own. In fact, as a doula, I would just throw my ball in the car, and if they needed it, I had it. So. Yeah.
And that is true.
And then I wanted to say, Krista asked about intermittent monitoring include the pressure cuff and IV. And technically, yes. Sorry, I have a dry throat, and I usually bring a water bottle, but
we're going to share. We're sisters.
Which she doesn't share, so.
I do sometimes.
I usually have my own.
Yes, but that is, the monitoring is, that is considered all of it. So that's your vitals.
So the IV, and we've talked about this before, the IV, you technically can refuse anything. Honestly, you can. So you just need to decide what's the most important to you. I have had moms that it's like the IV has been more important to them, that they don't have that than any other thing in their birth. Like it was the IV they thought was more painful than even the contractions in labor. So they didn't want that. And I will say that you still probably will get a lot of pushback that it has to happen, but it technically doesn't. So
but you can compromise with a head block.
Yeah. But that does still
still
puts the needle in your hand, and so there's that. So
but you're not tied to a cord.
But anymore. I would say, as far as especially IVs, if you can, stay home as long as possible, and then get to the hospital when you have less time. And typically they don't worry about the IV when you're like real close to delivering.
Yes. And yes, Becca, do you need an IV if you don't want pain meds? No.
So the big thing about the IV is that they take your blood, a sample of your blood at the beginning, especially in triage, to make sure they have, they check your platelets to make sure if you have enough platelets to be able to handle an epidural. Mm-hmm. So if you're not planning on having an epidural in and of itself, then you can absolutely refuse that. And then also, if you hemorrhage, they have your blood type available, but at the same time, that should all be in your paperwork. And then also having it there for if you are dehydrated, they can add fluids or Pitocin or whatever that needs to be. However, there's the flip side to everything. If you need fluids, you can just say, I will be drinking, and make sure that your partner, your birth team, somebody's making sure that you are drinking plenty of fluids between each contraction, that you're peeing every hour to hour and a half. That's a good indication that you're getting enough fluids. And then also the Pitocin, if you need Pitocin, they can do that in a shot too. Yeah. So you don't necessarily have to have it.
You have options, is what we're trying to tell you. And get our email, because we'll give you more information, a little bit more detailed, and we'll have it linked to a blog post. We'll have more information, because we're throwing you tons of information.
This is a lot.
And this could be a whole live in and of itself. So
just this one topic.
One topic. So we're just gonna pull back a little bit, and we love all these questions. So keep them coming, because if we don't get to your question tonight, we'll see kind of where most of our questions are coming from, and then we will we'll just do a question and answer where we answer all of your questions. So any questions you have regarding this, just throw them in the comments, and we'll just continue so that you can just know. And then
if you have questions, DM us,
yes,
or
all
however.
But we want to go into every woman has the right to wear whatever she wants while she is admitted in the hospital, when she is admitted into the hospital, or while she's laboring. And that is where the Dear Darby labor gown was born, was out of that right, that you can be naked if you want, you can wear a t-shirt, you can wear,
you do not have, you wear a robe, you can wear the hospital gown if you want, but you can legit be naked. If you you do not have to wear the hospital gown. You can wear whatever you want. So so because of that, we decided it would be fantastic to make an outfit that was beautiful, that women actually wanted to wear when they were in labor, because that's a tough situation to be in and still feel beautiful. So,
yes. And the thing is like, I get wanting to be naked because it is like the most convenient thing to be naked, but I have issues with as many people like seeing my naked body, and so
I will say your inhibitions are really low, if not gone, when you're in labor. But then on the flip side, when you're like, now you have your baby and now you're not in pain, and it's like, oh my gosh, I was totally naked.
Well, but I was, even through my contractions, I'd be like, oh my gosh, they're staring at my butt, and then I'd be like, but I'm having a contraction.
And it was
distracting. It was distracting. It was totally distracting. And then not to mention, we know several women that had hired like birth photographers and videographers, and then
didn't allow them to come in.
It was just, it was like their hospital gown did not work for them, and their comfort was first and foremost, which we 100% agree with. And so anyway, they paid for these services that they didn't even get the benefit out of because the hospital gown was so dysfunctional. So that's why we birthed this gown, because we wanted it to be functional, covering, and comfortable. So anyway, that's
a little plug.
It's the number one question we get is, can you even take this to the hospital? Yes. It is within your right to take it to the hospital. Oh, I skipped this one. Oh, wait.
No, you actually did it.
Oh, good.
I think you skipped 6.
I did.
Everyone has the right to accept or refuse procedures, drugs, tests, and treatments, and to have her choices honored. So that falls into the ID, all of the things, right? All of the things, you have the right to refuse anything. Yes. And they also can't make you sign anything. If they're like, okay, well, you're going against medical advice, you have to sign this, and if you sign this, then the insurance won't pay, because they do a lot of fear tactics in that aspect.
I know.
You don't. I just need you to know, you don't have to sign anything, and you don't have to accept anything. Just honestly use your intuition. Trust your gut.
And your judgment. And your judgment. Because if they're telling you things like that feel scary but don't have a good reason why, that's weird. But if they're telling you things that seem scary and they have a very good reason why, that makes sense. Yes, we will move forward.
Then I feel okay about that.
So it just is you and your birth partner just being educated, and then also just
trusting yourself.
Like,
check in with yourself. And here's the best part. This is my favorite thing to do and to suggest for parents, is that when anything is suggested, you say, okay, can we have get all the information that you can, and then you say, okay, can we have a minute to think about it? And then, so you're not trying to like communicate with your eyes, like, should we do this? What do you think?
Yeah.
I don't know. Do you think that? Like, because you can't
give us a minute.
So then they leave, and then you can talk about it. You can pray about it. You can meditate about it. You can ask your baby about it, and see overall how you feel about everything, and then ultimately make a decision.
And one of my favorite things, one of my births, what we did was, there were some complications happening, and she really didn't like what was happening, but so I just said, let's ask for an hour. So are we okay to go one hour and then reassess? And they were like, yeah, for sure, let's go 1 hour. When it seemed like, oh my gosh, we got to do something right now. But then she asked for an hour, and they were like, oh sure, no big deal. And then we got to that point, to the hour, and they assessed again, and she said, well, can we do 1 more hour? Yes. And then within those 2 hours, the babies came, and it was no big deal.
I will say too, very rarely are there, even the emergencies that feel like crazy emergencies, they still have time available.
Yeah, just a little,
You're there, and so very rarely is it actually like, okay, this is happening this second. You don't have a choice.
It might feel like
it might feel like it, but ask, say, do we have a minute to think about it or talk about it?
There's always a minute to think about it, and if you ask for the hour and they say no, then you know, okay,
this is more intense.
This is more intense. So it's just a lot of question asking. But the cool part is, you guys, in the questions, because all of these rights are because of questions. It's just asking the questions and knowing your rights.
And knowing all the information.
And knowing the information. But it's in knowing to ask the question that it changes your birth. Because instead of leaving your birth saying, they made me do this and then this happened and it was so scary, just saying, can we have a minute? Or what do you mean by that? Or can we have an hour? Or what is another option? Just those questions completely change your experience, because then you know when you come out of that experience that, yes, that was my choice. I asked for a compromise and there was no compromise. I had to do what I had to do. So then it doesn't feel as traumatic. It feels more like, oh, I did everything I could do. I asked every question that I could. So that's
like, I didn't know, I knew what was happening to me.
Yes.
Because that's the difference between somebody being like, I don't know, they just did it. And
asking for a moment and just for more information. So that's really where our soapbox comes on, is you don't need to know everything that's happening. You don't need to be a medical doctor or a nurse to have the right information,
and you can fill it out.
Yeah, just know the questions to ask. So maybe we should do a whole generic questions to ask when
you're in labor. Actually, there's a good thing in here. When we get to it, I'll tell you.
Okay. So every woman has the right to information about the professional identity and qualifications of those involved with her care, and to know when those that are involved in her care are trainees. We love this one, and we've had good feedback from care providers about this one. So basically,
you can go in and ask a care provider, okay, what are your rates? Like know their information, know their history.
Like their stats.
What are their stats? Sorry, their stats. So like, what are your cesarean section stats? Like how many moms in your practice end up with a cesarean,
or in a episiotomy, or an induction, or
unmedicated.
Yeah, or unmedicated, because that's really good. So if you wanted an unmedicated birth and the doctor only has 1% or 10% of
their
patients want an unmedicated birth, you might know they don't have a ton of experience with it, and it's not their fault. It's just that's
they typically like to work with women who have
medicated
births or something.
Which is so good. So if you are having a medicated birth, you know that is right where you want to be. If you aren't, then you might think, okay, I love this doctor, but we're not aligned. We might not be as aligned on our goals. So and the cool thing, we had a group of midwives that were such a good, because this is not, when you ask the doctor for their stats, it's not being condescending or rude. It actually is super helpful to
get their feet, or for them.
So a group of midwives said this: it also keeps practitioners honest and encourages us to keep our stats current. If we begin to see a positive or negative trend in our practices, we can strengthen our weaknesses and get better. So you're actually doing a favor to these care providers by asking their stats, because it keeps them current and up to date, kind of with where their weaknesses and strengths might lie.
And maybe the type of patients that they have.
Yeah.
So, which is pretty cool.
Yes. Okay. So every woman, this kind of goes with what we've been talking about, but every woman has the right to full and clear information about benefits, risks, and costs. Costs is a good one. Of procedures, drugs, tests, and treatments offered to her, as well as other reasonable options, including interventions. No interventions.
So this is where I was so the list of questions. Okay. If you can just remember this acronym, and you'll see it in a lot of childbirth classes and a lot of birth workers will tell you to work with this. But if you can remember your brain, BRAIN, then you will get all of the information that you need. So if you ask anything that's suggested to you or recommended or forced upon you, I don't know, you can ask, what are the benefits? What are all the benefits of this, whatever you're asking me? What are the benefits? And then R is, what are the risks? What are the risks of this procedure? What's going to happen what are the potential risks? BRA is alternatives. Do I have any alternatives? Like what, just like the Pitocin, like, yes, they like to put it in a drip in your IV, but they also have it in a shot. Or maybe you test positive for group B strep. Typically the treatment is you take antibiotics, they drip in antibiotics, and so that they want you to have an IV. What are alternatives that I have? So that opens up a discussion. That's
or
A.
The compromise. How can we, whatever.
Mm-hmm.
How can we both get what we want?
So A, alternatives. I is using your intuition. So we talked about that before. Yes. Check in with yourself, check in with your baby, meditate, pray, talk to your spouse or partner, and really assess like how you feel about it. If you're feeling, then notice that, honestly.
Yes. And then maybe do the N, which is?
N is nothing. What if we do nothing now? So
what if we wait an hour?
What if we wait an hour? What do we have an hour to wait? Yeah, we can do that. Let's try waiting an hour. So if you can remember to your brain, B, benefits, risks, alternatives, intuition, nothing. And those are excellent questions. You'll get all the information you need with just those 5 questions.
Those 5 questions is a good one. So next one is, every woman has the right to be informed if her caregivers wish to enroll her or her infant in research studies.
Kind of straightforward.
Yeah.
You should never be in a study without your knowledge or consent. Yeah. So,
and we have no idea how often that happens or not.
Yeah, I don't know.
It's just, we want you to know it's one of your
rights.
Rights. Okay, number 11. Every woman has the right to unrestricted access to all available records about her pregnancy, birth, and postpartum, and her infant, to obtain a full copy of these records and to receive help in understanding them if necessary.
Which is a big deal, because sometimes the records, you have no idea what like it doesn't make any sense. So quick story. I had one mom, it was her second baby, and she was really trying to figure out, and I posted about this, so if you saw this post, then maybe you recall this story, but she was trying to figure out where she wanted to give birth, and she was like well into 20 weeks or getting close to 20 weeks, and she still hadn't like decided. She was going to 2 different practices because she wanted an out-of-hospital birth, but with her first baby she had hemorrhaged, and so she was really, really concerned and really nervous about hemorrhaging again and not being in a hospital setting where that might be a benefit to be if she hemorrhaged. And so she was again going back and forth, and so she decided to get her records from her previous birth, pregnancy and labor and birth and all of that. She got all of her records, and when she was going through them, she saw that in the notes it said that she lost I think 400
milliliters
400 milliliters of blood, which, looking up and doing some research, is in the normal range of blood loss. Your normal blood loss in a labor and delivery is between 200 milliliters and 500. So she was 400, so it was on the higher end, but she wasn't actually hemorrhaging. So she's not sure if it was just like something that was said or something that was mentioned,
or she just picked it up somewhere,
or she thought that she lost a lot of blood. I mean, I'm sure I'm usually we take things that people say and it's like, oh my gosh,
that was scary,
or that. So it actually affected her mental state, and she went on for 2 years
of her birth.
Mm-hmm. She went on for 2 years thinking that she had hemorrhaged when she actually hadn't hemorrhaged. And so that actually gave her a ton of relief. It healed a lot of her perception of her first birth. And her fears. Yep. And she chose to have an out-of-hospital experience with her second baby and had a beautiful, wonderful birth. And she was really happy about it. So having your records and understanding what is going on in your pregnancy and labor and birth is all within your rights. You can ask for copies and they will give it to you.
Yes. Number 12, every woman has the right to receive maternity care that is appropriate to her culture and religious background and to receive information in a language she can communicate. So if English is not your first language and you are in the United States, ask for care in your language so that you can understand, so that you can ask the appropriate questions that you need.
Yeah.
Also with your religious and cultural background, if there are things that, men are not supposed to be in the room, or you need to maintain coverage, or, I don't know what.
Circumcision.
Yes, that's another one. So that's your right. 13.
Every woman has the right to receive continuous social, emotional, and physical support during labor and birth from a caregiver who has been trained in labor support. So it's within your right to have a doula, to have people there that you are familiar with and that are trained. So you can't be told that you can't have a doula at your birth. Yeah. You can have them there. So, sorry.
No, you're good.
We both licked our fingers.
Yes, go ahead.
Okay, every woman has the right to virtually uninterrupted contact with her newborn from the moment of birth, as long as she and her baby are healthy and do not need care that require separation. Okay, let me reiterate. As long as the baby is healthy, you do not need to be separated from your baby.
Yeah.
And so this is a little bit difficult because there's lots of instances in the hospital when they make you feel like your baby's life is in peril. And so, like as far as resuscitation, there's a lot of respiratory issues sometimes that happen, and
that can all be done on your chest.
That can be done on your chest, and just
it's not as convenient, but it can all be done.
Plug for skin to skin is that actually they have done studies, and there are studies out there that show that baby will regulate everything when they're skin to skin. So that we're talking their respiration,
blood sugar,
their metabolism, their blood pressure, their blood sugars, their I had one birth that they took the baby away and they said, okay, well, baby's like their breathing is quick, their heart rate was quick, and so what they did was put ice on the baby instead, and to shock the heart into slowing down, instead of maybe first we should try giving the baby to mom.
Give baby to mom, and they're doing better. They're doing so much better. There's so many studies that have come out with the benefit of skin to skin and the contact with the mother that really I haven't seen
that kind of crazy
but those practices as much anymore. They're really seeing the benefit of that. And also it just, like, if they want to bathe the baby or do the baby's vitals, they don't have to take the baby away from you. That can all be done on you.
And it doesn't need to happen within the first hour.
No,
you can absolutely ask that any of the newborn procedures can all be done after an hour.
Yes.
It's like if you want the antibiotic eye ointment, the PKU, the Hep B shot, like all of the newborn procedures can all be done after an hour, and which is, again, up to you. You can decide if you want to do that or not. That can also facilitate breastfeeding if you're wanting to breastfeed, because a lot of that separation can inhibit some of the opportunity for breastfeeding.
So
and the connection,
just so you know, if they're like, hey, it's time to take the baby away, you can say, I'd like to keep the baby as long as possible. And then
at least an hour. And you can say at least an hour. And then at the end of an hour we'll assess and see. And then again, they can do all of the like APGAR score, everything like that while the baby's on you.
So anything they need to do, and they're getting so good at it. So much better.
Krista, your hospital gave you 2 hours for skin to skin.
Oh,
that's
perfect.
awesome.
So they are. They're getting better.
They're again, it's awesome. 15, every woman has the right to receive complete information about the benefits of breastfeeding well in advance of labor, to refuse supplemental bottles and other actions, and to interfere with breastfeeding, and have access to skilled lactation support for as long as she chooses to breastfeed.
And the hospital's really clear with this.
And they're really good at that.
Really good at that.
Also, you can supplement if you want to. On the flip side, if you're feeling like you want to supplement, or you're just not getting it, or it's really stressful for you to breastfeed, you have the within your right to supplement as well.
So know that.
Last one. Every woman has the right to decide collaboratively which caregivers when she and her baby will leave the birth site for home based on their conditions and circumstances. So that's, if you're feeling like you're ready to go and baby's good and you're good, you can decide
with your caregiver if they are like, yep, looks good, you're ready to go. So and we know how at a birth center, how long is it? 12 hours?
It depends. So for me, I was with my first baby, it was 4. After 4 hours, I could go home. I could go home. And at first I thought like, oh, that's like really quick. But it was like 4 hours after like the clock is started, she's born. It was more like when things had settled down, like after I had needed some repair work, so after they did the stitches and things like that, then it was like, okay, well, we're leaving now, you have 4 hours, and then you can head home if you want. And at that point for me, I was like, it was like 7 o'clock at night, and I was like, 4 hours is gonna be like midnight, I don't want to go home at midnight. I was like, can I leave now? And they're like, yeah, sure. So we just got in our car, called takeout on the way and picked up some Olive Garden and ate some dinner and tucked our baby in and went to bed.
I love that. So my first baby, we stayed the whole time, and I feel like I was the whole time in the hospital, the 3 days, and the whole time I was like, I just want to go home, I just want to go home. But then my second baby,
you were like,
I stayed for as long as I was like, wait, I got 4 more hours. Yes, I only stayed 4 more hours.
That's funny.
Just because I didn't want to go home.
Yes, but that does happen. Okay, let's see if there's any quick questions. I know we're headed a lot of, we've been on here
forever.
Would a doula count as the total people you want in the room, or would it take up a spot in the family? Oh, we
must have missed that one.
That is interesting, and that's
one of your rights.
Is you can
choose as many. You can have anyone in your hospital room, and they'll say hospital policy says you can only have 4, and you can say
every woman has the right to have family members and friends of her choice present or not present during all aspects of maternity care. So, and that can include your kids too. And I know that there's a hospital policy that in the winter months that people that are under a certain age aren't allowed in the hospital. That's actually within your rights to allow them into your room. If they are outside of the room, they would have to wear a mask
and maybe even a gown.
But in your room, they're allowed in your room. Yeah. So just know that you can have people in your care. I would say there is a little bit stricter policy with cesarean sections. I, as a doula, have never been allowed into a C-section, so I don't know if I don't know if that's going to change besides a partner. Yeah. But there's some hospitals that are doing better with like mother-friendly cesarean, where they're allowing like photographers and like they lower the curtain a little bit more so that they can actually see the baby. They don't necessarily see the surgery, but see the baby being born. And
so there are some really good advances as far as really making birth less sterile and not sterile, but you know what I mean, like less risk friendly.
Yeah, like high emergency.
High emergency. I don't know, but there is. But yeah, these are just some really good rights for you guys to pay attention to. So a couple of things. Number one, go to the link in our bio. The very first one is to get on our email list. So if you want all of this information in a really more digestible form, go to the email, give us your email. You'll get,
and then you can have
all the information
in a better,
yes,
in a better,
in a digestible form that you can peruse at your leisure. And so that's number one. Number two, since you were here and you commented, and if you're on our email list, we have a little giveaway tonight.
You guys ready for the giveaway?
It's
that was
so
going to be
cute.
okay. It's in this little bag, and this will be for one of you pregnant mamas. We've got newborn moccasins.
Tiny baby.
Are those not the
feet.
cutest things in the whole world?
They're so tiny and they're so cute. So these black little moccasins, we're so thankful you were here and you commented and you asked questions. It's our favorite.
Yes,
so we will be
guys.
choosing somebody to get these little newborn moccasins. So, which are always within your rights to have.
You get to have these. Maybe for a coming home. Oh,
yes, they're so cute.
Coming home outfit. So, we sure love you, and we'll announce the winner of the giveaway on Thursday.
Yep,
in the email.
In the email, and then we'll put on social after that. So we're just thankful for you, and hope this wasn't overwhelming. But seriously, if you watch this and have more questions, just like fire at us as many questions.
Yeah,
because
DM us.
We want to know. We want to know what your pain points are and how we can support you with information.
Yes.
Okay.
All right.
Bye.
Have a good night.